Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the carotid sheath. What is carotid sheath? This is a tubular condensation of the deep cervical fascia around the common carotid artery, internal carotid artery, and vagus nerve. So this is the carotid sheath. It is a tubular condensation of deep cervical fascia around the common carotid artery, internal carotid artery, internal jugular vein, and the vagus nerve. Another one is here on this side. Okay. The ansa cervicalis is a loop of nerve from cervical 1, 2, and 3 is either embedded in its anterior wall or it is just anterior to the carotid sheath. It is variably contributed by the investing layer, pretracheal layer. This is the investing layer. This is the pretracheal layer of the cervical fascia, and this is the prevertebral layer of the deep cervical fascia. So they contribute in the formation of the carotid sheath. The contribution is variable from side to side. Okay. So extension of the carotid sheath from the base of the skull to the superior mediastinum. The carotid sheath connective tissue blended with the tunica adventitia at the level of the upper part of the hyoid bone level and also at the root of the neck with that of the tunica adventitia of the blood vessels. So this will blend with the tunica adventitia at the upper part of the neck, at the level of the superior part of the hyoid bone, and also this will blend with the tunica adventitia of the blood vessel and the root of the neck. Its extension from the skull to the superior mediastinum at the root of the neck. It is thicker over the artery. Artery means this is the common carotid artery. It is thicker and thinner over the vein that will help in proper venous return and vein expansion. What are the relations of the carotid sheath? Well, it is under the sternocleidomastoid muscle in some places, the lower part of the neck. It is also covered by the infrahyoid muscle partly, and it is lateral to the trachea, esophagus, and thyroid gland. It is in front of the prevertebral fascia, and it is in front of the sympathetic chain of ganglion, that is the cervical sympathetic chain of ganglion. So carotid sheath is in front of that, and the cervical chain of ganglion is actually embedded on the prevertebral fascia. Okay, so and this sheath is blended with other sheath like that of the thyroid and esophageal sheath here. So this is continuous with other structure, the carotid sheath. So these are the relationship. And what is the clinical significance of carotid sheath? It holds the structures together. But it may be a route of spread of infection that communicate the mediastinum to the skull. So it may be a route of spread of infection. Okay. Now again we'll summarize carotid sheath formed by the deep cervical fascia. Deep cervical fascia has three layers: investing layer, the pretracheal layer, prevertebral layer. All these layers contribute in the formation of this tubular sheath that extend from the base of the skull to the root of the neck. And at the base of the skull, the level of the upper part of the hyoid bone, the carotid sheath blended with that of the tunica adventitia of the blood vessel, like that at the root of the neck, just above the superior mediastinum. The carotid sheath blend with the tunica adventitia of the blood vessels. What are the contents of carotid sheath? Common and internal carotid arteries, internal jugular vein, vagus nerve, some deep cervical lymph nodes, carotid sinus and carotid body nerves, sympathetic nerve fibers, carotid periarterial plexus. Okay. So, common and internal carotid arteries, but not the external carotid artery. External carotid artery is not a content of the carotid sheath. Internal jugular vein, not the external jugular vein. Okay. Some deep cervical lymph node, but this lymph node will open into the thoracic duct. Thoracic duct, right lymphatic duct are not a content of carotid sheath. But carotid sheath contains some deep cervical lymph node that will open into the either thoracic duct or into the right lymphatic duct. Carotid sinus for the baroreceptor function. Carotid body for the chemoreceptor function. Carotid sinus senses the blood pressure. It is getting innervation from the glossopharyngeal nerve. Carotid body is getting innervation from the glossopharyngeal nerve and vagus nerve. And carotid body maintains the blood pH level, senses the carbon dioxide level in the body. And this nerve communicate or sense the information to the brainstem to maintain blood pressure, to maintain blood pH. Sympathetic nerve fibers are coming out of these are the postganglionic fiber from the superior cervical sympathetic ganglion and the middle cervical sympathetic ganglion and inferior cervical sympathetic ganglion. They will go inside the carotid sheath and they will pass over the carotid arteries to the head and neck structure and provide sympathetic innervation. These are the carotid periarterial plexuses. And that's all about the anatomy of the carotid sheath. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.